The following is a patient of Los Angeles-based hair transplant surgeon Dr. Marc Dauer. So Bobby's just under 2 weeks after his first hair transplant procedure. Can you tell us a little bit about how you came to see me for this procedure, and if you had had other consultations prior, and tell us a little bit about your experience?
Sure. So before I came in, I actually went to a lot of doctors, especially I think the much hyped about Dr. Bosley. But what I didn't find in other doctors was like personal care and lack of attention to detail. When I came to you, actually, you took my case very personally, and I felt you gave me the right advice, on how to proceed.
What was your experience like with the procedure itself?
Yeah, when I first came in for the procedure, I was very apprehensive that it's gonna be very painful, very bloody. I would not be able to go to work, for the next couple of weeks. But the day of the procedure itself was, pretty good actually. No pain, nothing. I was basically able to drive out of the office actually, if I remember it correctly. The very next day I was at work, with no pain, and everything was looking good, and since I've come back now, after 2 weeks to have my sutures removed, you can see it's healed pretty well, the whole area actually, and it's all looking pretty good. Sure, I'm very very excited about it. In 6 to 9 months, I just can't wait to see the results, with the hair growing at the front, at the back actually, and judging by how it's gone right now, I think I'm pretty optimistic.
Fantastic. So here's the hairline just under 2 weeks later, and you can see the angle and the orientation of all the grafts and how they're matching the existing angle and orientation of the existing hair all the way around. And then, Bobby, if you could put your head down for a moment, if you can look closely in the crown area, you can see all these grafts in the crown, and you see how they're going with very particular angles and orientation to match the existing hair. So the hair over here is growing like that, and the hair is growing like that, to create the natural looking whorl, so that when the hair goes in, it will be completely natural and undetectable. The preceding has been a patient of Los Angeles-based hair transplant surgeon Dr. Marc Dauer.